Question 1. Cost-benefit analysis shows that increasing community health worker outreach hours is associated with higher rates of participation in a new preventative health program. A public health official is tasked with recommending resource allocation for this outreach. Given that program participation is a binary outcome, participated or did not participate, which approach to analyzing the relationship between outreach hours and participation is most appropriate for informing policy decisions? Option A. Utilize logistic regression to model the probability of program participation as a function of outreach hours, while also exploring potential confounders and effect modifiers. Option B. Apply linear regression to predict the number of participants based on outreach hours, assuming a direct linear relationship. Option C. Focus solely on the p-value from a simple correlation analysis between outreach hours and participation to determine statistical significance. Option D. Recommend increasing outreach hours based on the initial cost-benefit analysis without further statistical modeling, as the association is already established. The correct answer is A. Utilize logistic regression to model the probability of program participation as a function of outreach hours, while also exploring potential confounders and effect modifiers. Explanation. This scenario presents a common challenge in public health where statistical findings must be translated into actionable policy recommendations, balancing evidence with practical implementation and ethical considerations. The professional challenge lies in interpreting regression analysis results accurately and applying them appropriately within the existing regulatory framework for public health interventions. Careful judgment is required to avoid oversimplification or misapplication of statistical models, which could lead to ineffective or inequitable resource allocation. The correct approach represents best professional practice because it acknowledges the limitations of linear regression in predicting binary outcomes and correctly identifies logistic regression as the more appropriate statistical tool for analyzing the relationship between a continuous predictor, e.g., hours of community outreach, and a dichotomous outcome, e.g., program participation. This aligns with the principles of evidence-based public health practice, which mandates the use of sound statistical methodologies to inform decision-making. Furthermore, it emphasizes the importance of considering confounding factors and effect modification, crucial for developing targeted and effective interventions that comply with public health guidelines promoting equity and efficiency. An incorrect approach that relies solely on linear regression for a binary outcome fails to adhere to the fundamental assumptions of the model, leading to potentially misleading predictions and flawed policy recommendations. This can result in misallocation of resources and ineffective program design, violating the ethical imperative to use public funds judiciously and to maximize public health benefit. Another incorrect approach that ignores the statistical findings and proceeds with a predetermined intervention, regardless of the evidence, demonstrates a failure to engage in a data-driven decision-making process. This bypasses the regulatory requirement for evidence-based interventions and can lead to programs that are not only ineffective, but also potentially harmful by diverting resources from proven strategies. A third incorrect approach that focuses only on statistical significance without considering practical significance or the underlying public health context overlooks the ultimate goal of public health interventions: improving population health outcomes. This can lead to the implementation of interventions that have a statistically detectable but practically negligible impact, failing to meet the public health mandate for meaningful improvement. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and the desired outcome. This is followed by a thorough review of existing literature and data, including the selection of appropriate statistical methodologies for analysis. The interpretation of statistical results must then be integrated with an understanding of the public health context, ethical considerations, and regulatory requirements. Finally, policy recommendations should be developed based on a comprehensive evaluation of the evidence, potential impact, feasibility, and equity. Question 2. Upon reviewing preliminary data suggesting a correlation between a specific dietary supplement and a reduction in a common chronic disease, a public health researcher is tasked with designing a study to further investigate this relationship. The supplement is widely available over the counter, but there are concerns about potential long-term side effects that are not yet fully understood, particularly in individuals with pre-existing health conditions. The researcher must select a study design that can best establish a causal link while minimizing ethical risks to participants. Option A. A prospective cohort study following individuals who choose to take the supplement versus those who do not, collecting data on disease incidence and potential side effects over several years. Option B. A cross-sectional study surveying individuals about their current supplement use and disease status at a single point in time. Option C. A randomized controlled trial where participants are randomly assigned to receive the supplement or a placebo, with close monitoring for disease development and side effects. Option D. A case control study comparing individuals with the chronic disease to similar individuals without the disease, asking about their past use of the dietary supplement. The correct answer is A. A prospective cohort study following individuals who choose to take the supplement versus those who do not, collecting data on disease incidence and potential side effects over several years. Explanation. This scenario presents a professional challenge due to the inherent tension between the need to gather robust public health data and the ethical imperative to protect vulnerable populations from potential harm or exploitation. The chosen study design must balance scientific rigor with the principles of beneficence, non-maleficence, and justice. Careful judgment is required to select a design that minimizes risk while maximizing the potential for meaningful public health insights. The correct approach represents best professional practice because it prioritizes the well-being of the participants and adheres to the ethical guidelines governing public health research. Specifically, it acknowledges the potential for bias and confounding in observational studies when investigating sensitive health behaviors. By employing a design that allows for the establishment of temporal relationships between exposure and outcome, and by controlling for confounding factors, the study can generate more reliable evidence to inform public health interventions. This aligns with the principles of evidence-based public health practice and the ethical responsibility to conduct research that is both scientifically sound and ethically defensible. An incorrect approach that relies solely on a cross-sectional design would fail to establish causality, making it difficult to determine if the observed association is due to the exposure or the outcome. This could lead to misinformed public health recommendations and potentially ineffective or even harmful interventions. An approach that uses a case-controlled design without careful selection of controls or consideration of recall bias could also yield misleading results, as it relies on retrospective data collection. Furthermore, a randomized controlled trial, while offering the highest level of evidence for causality, may not be feasible or ethical in this context due to the nature of the exposure and the potential for harm. Each of these incorrect approaches risks generating flawed evidence, which is a direct ethical failure in public health research, as it can lead to misallocation of resources and harm to the population. Professionals should approach such situations by first clearly defining the research question and its public health significance. They must then critically evaluate the strengths and limitations of various study designs in relation to the research question, the target population, and ethical considerations. A thorough risk-benefit analysis is crucial, considering potential harms to participants and the potential benefits of the research findings. Consultation with ethics review boards and subject matter experts is also a vital part of the decision-making process to ensure that the chosen design is both scientifically appropriate and ethically sound. Question 3. During the evaluation of a novel infectious disease outbreak with limited vaccine supply, a public health official is faced with competing demands from various community groups, each advocating for prioritized access for their specific constituents. The official must decide on an allocation strategy that balances urgency, equity, and the overall goal of disease containment. Option A. Prioritize allocation to the community group that has the most vocal and influential leadership, as this will ensure broader public acceptance of the decision. Option B. Allocate the majority of the initial vaccine supply to a single, well-connected community to demonstrate rapid progress and create a positive narrative, with plans to address other groups later. Option C. Develop a transparent allocation framework based on objective criteria such as risk of severe illness, potential for transmission, and essential worker status, and communicate this framework clearly to all stakeholders. Option D. Implement a first-come, first-served system to avoid accusations of favoritism, even if it means some high-risk individuals may not receive the vaccine promptly. The correct answer is C. Develop a transparent allocation framework based on objective criteria such as risk of severe illness, potential for transmission, and essential worker status, and communicate this framework clearly to all stakeholders. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate need to address a public health crisis and the ethical obligation to ensure equitable distribution of limited resources. The public health professional must navigate the complexities of resource allocation, stakeholder pressures, and the potential for unintended consequences. Careful judgment is required to balance competing interests and uphold core public health principles. The correct approach represents best professional practice because it prioritizes a transparent, evidence-based, and equitable decision-making process. This aligns with fundamental public health ethics, such as justice and fairness, and regulatory frameworks that mandate rational resource allocation during emergencies. By engaging stakeholders and using objective criteria, the professional upholds public trust and ensures that decisions are defensible and minimize harm. An incorrect approach that focuses solely on political expediency or the loudest voices fails to adhere to principles of justice and equity. It risks creating disparities in access to essential interventions, potentially exacerbating existing health inequities and undermining public confidence in the public health system. Such an approach may also violate regulatory requirements for fair and rational resource allocation. Another incorrect approach that prioritizes a first-come, first-served model, while seemingly simple, ignores the critical public health goal of maximizing benefit and minimizing harm. This can lead to individuals with greater access or resources benefiting first, potentially leaving vulnerable populations underserved and prolonging the public health threat. It fails to consider the ethical imperative to protect those most at risk. A professional decision-making process for similar situations should involve 1. Clearly defining the public health problem and the available resources. 2. Identifying and engaging all relevant stakeholders. 3. Establishing transparent and objective criteria for resource allocation based on public health principles and evidence. 4. Developing a clear communication plan. And 5. Establishing a mechanism for ongoing evaluation and adaptation of the allocation strategy. This systematic approach ensures that decisions are ethical, equitable, and effective. Question 4. Stakeholder feedback indicates a significant concern regarding access to affordable housing and its impact on chronic disease rates within a low-income urban community. The Public Health Department is tasked with developing a new initiative to address this. Which of the following approaches best aligns with public health principles and regulatory expectations for addressing social determinants of health? Option A. Allocate funding towards immediate, short-term housing assistance programs for a limited number of individuals, without conducting a thorough analysis of long-term housing affordability or the broader impact on community health. Option B. Conduct a comprehensive needs assessment by analyzing existing health data, demographic information, and qualitative feedback from community members and local organizations to identify specific housing-related barriers and their correlation with health outcomes. Subsequently, develop targeted, evidence-based interventions in partnership with housing authorities and community groups, focusing on measurable improvements in housing stability and health indicators. Option C. Focus resources on addressing the concerns of the most vocal community leaders and elected officials who have expressed strong opinions on housing policy, assuming their priorities represent the broader community's needs. Option D. Prioritize interventions that are easiest to implement and measure, such as distributing informational pamphlets on housing resources, even if the underlying systemic issues of affordability and availability are not directly addressed. The correct answer is B. Conduct a comprehensive needs assessment by analyzing existing health data, demographic information, and qualitative feedback from community members and local organizations to identify specific housing-related barriers and their correlation with health outcomes. Subsequently, develop targeted, evidence-based interventions in partnership with housing authorities and community groups, focusing on measurable improvements in housing stability and health indicators. Explanation. This scenario presents a common challenge in public health, addressing the multifaceted nature of social determinants of health (SDO) within a constrained resource environment and with diverse stakeholder priorities. The professional challenge lies in synthesizing complex, often qualitative, feedback into actionable strategies that are both evidence-based and politically feasible, while adhering to ethical principles of equity and community engagement. Careful judgment is required to prioritize interventions that will have the most significant and sustainable impact on health disparities. The correct approach represents best professional practice because it prioritizes a data-driven, community-centered strategy that aligns with the core principles of public health ethics and regulatory frameworks emphasizing health equity and evidence-based interventions. Specifically, it involves a systematic review of existing data and stakeholder input to identify the most pressing ESDO issues, and then developing targeted, evidence-based interventions. This approach respects the lived experiences of the community, ensures accountability through measurable outcomes, and is consistent with guidelines that mandate the use of scientific evidence and community participation in program development. It also reflects a commitment to addressing systemic inequities, a fundamental tenet of public health. An incorrect approach that focuses solely on the most vocal or politically influential stakeholders fails to uphold the principle of equity, potentially marginalizing the needs of less vocal but equally or more vulnerable populations. This can lead to interventions that exacerbate existing disparities. Another incorrect approach that prioritizes easily measurable but less impactful interventions neglects the deeper, systemic causes of health inequities, thus failing to achieve meaningful and sustainable health improvements. This also represents a failure to adhere to evidence-based practice, as it bypasses a thorough assessment of what interventions are most effective. An approach that dismisses stakeholder feedback as anecdotal without rigorous analysis ignores valuable qualitative data that can illuminate the nuances of ESDO and community needs, leading to interventions that are disconnected from the realities faced by the population. This can also be seen as a failure in community engagement and partnership, which are often mandated or strongly encouraged by public health regulations. The professional decision-making process for similar situations should involve a structured approach. First, comprehensively gather and analyze all forms of stakeholder feedback, including qualitative data, alongside existing quantitative health and ESDO data. Second, conduct a thorough review of evidence-based interventions for identified ESDO issues, considering their feasibility and potential impact. Third, prioritize interventions based on a combination of evidence, community need, equity considerations, and resource availability. Fourth, develop a clear implementation plan with measurable outcomes and a robust evaluation framework. Finally, maintain ongoing communication and engagement with stakeholders throughout the process to ensure transparency and adapt strategies as needed. Question 5. Consider a scenario where a public health study investigating the association between a specific environmental exposure and a rare disease yields a p-value of 0.03 and a 95% confidence interval for the odds ratio of 1.05 to 1.10. The study was well designed with minimal bias, which interpretation best guides subsequent public health action. Option A. The confidence interval suggests a plausible range of increased risk, but since the p-value is only marginally significant, the evidence is too weak to support any public health interventions. Option B. The observed association is statistically significant, and the confidence interval suggests a small but potentially meaningful increase in risk that warrants further investigation and consideration for targeted public health interventions. Option C. The confidence interval is too wide to draw any meaningful conclusions, and the p-value's marginal significance means the association is likely due to random chance, so no action should be taken. Option D. The observed association is statistically significant, but the confidence interval indicates the effect size is too small to be of practical public health importance, and no further action is recommended. The correct answer is B. The observed association is statistically significant, and the confidence interval suggests a small but potentially meaningful increase in risk that warrants further investigation and consideration for targeted public health interventions. Explanation. This scenario presents a common challenge in public health practice, interpreting statistical findings in the context of public health impact and policy decisions. The core difficulty lies in translating statistical significance into meaningful public health action, especially when resources are limited and potential interventions carry their own risks and benefits. Professionals must balance the rigor of statistical inference with the practical realities of public health implementation. The correct approach emphasizes understanding the implications of both statistical significance and the magnitude of the observed effect. A statistically significant finding, low p-value, indicates that the observed association is unlikely due to random chance. However, a confidence interval provides a range of plausible values for the true effect size. A narrow confidence interval that includes clinically or epidemiologically meaningful values, even if the point estimate is modest, warrants further investigation and potential action. This approach aligns with the principles of evidence-based public health, which requires not only identifying associations, but also assessing their practical importance and the certainty of the estimate. It also reflects the ethical responsibility to act on credible evidence to protect and improve population health. An incorrect approach would be to solely focus on the p-value and disregard the confidence interval. Relying only on a low p-value to declare an association, as important, ignores the potential for a very small, statistically significant effect that may have negligible public health impact. This can lead to misallocation of resources or unnecessary alarm. Conversely, dismissing a statistically significant finding solely because the point estimate is small, without considering the confidence interval, could mean overlooking a potentially important signal, especially if the confidence interval suggests a larger effect is plausible. Another incorrect approach would be to overemphasize the confidence interval without considering the p-value. While the confidence interval provides a range, a wide interval with a p-value that is not statistically significant might indicate insufficient evidence to conclude an association exists, and acting solely on the interval could lead to premature or unfounded interventions. The professional decision-making process in such situations should involve a multifaceted evaluation. First, critically assess the statistical results, considering both the p-value and the confidence interval in conjunction with the study design and potential biases. Second, evaluate the public health significance of the observed effect size, considering the burden of disease, potential for intervention, and the context of the population. Third, consider the certainty of the evidence, as indicated by the width of the confidence interval. Finally, engage in a risk-benefit analysis of potential interventions, considering feasibility, cost, and potential harms before making policy or programmatic recommendations. Question 6. The review process indicates that a local community is experiencing elevated rates of respiratory illnesses, with preliminary investigations suggesting a potential link to air pollution from a nearby industrial facility. As a certified and public health professional, what is the most appropriate approach to inform the development of environmental health policies and regulations to address this situation? Option A. Prioritize economic impact studies of potential regulations on the industrial facility and the local economy, delaying any policy recommendations until a complete economic feasibility analysis is concluded. Option B. Advocate for immediate closure of the industrial facility based on public concern and anecdotal reports of illness, without a formal assessment of the specific pollutants or their contribution to the observed health issues. Option C. Conduct a comprehensive environmental health risk assessment, adhering to the established regulatory framework for air quality standards and health impact evaluations within the jurisdiction, to identify specific pollutants, exposure levels, and associated health risks, and use these findings to propose evidence-based policy interventions. Option D. Focus policy development solely on implementing stricter emission controls for all industries in the region, regardless of their specific contribution to the current health concerns, to ensure a broad precautionary measure. The correct answer is C. Conduct a comprehensive environmental health risk assessment, adhering to the established regulatory framework for air quality standards and health impact evaluations within the jurisdiction, to identify specific pollutants, exposure levels, and associated health risks, and use these findings to propose evidence-based policy interventions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a public health professional to navigate the complexities of environmental health policy and regulation within a specific jurisdiction, balancing scientific evidence with legal mandates and public interest. The challenge lies in accurately applying the principles of risk assessment to inform policy decisions, ensuring that the chosen approach aligns with established regulatory frameworks and ethical considerations for protecting public health. The potential for differing interpretations of scientific data and the need to communicate risk effectively to stakeholders add further layers of complexity. Correct approach analysis. The correct approach involves a systematic and evidence-based risk assessment that adheres strictly to the established regulatory framework for environmental health policies in the specified jurisdiction. This means identifying hazards, characterizing exposure, assessing dose-response relationships, and characterizing risk in a manner consistent with relevant laws and guidelines. This approach is best professional practice because it ensures that policy recommendations are grounded in scientific rigor, are legally defensible, and prioritize the protection of public health by addressing the most significant environmental threats in a quantifiable and actionable way. It aligns with the ethical obligation of public health professionals to act in the best interest of the community and to base their actions on sound scientific principles and regulatory compliance. Incorrect approaches analysis, an approach that relies solely on anecdotal evidence or public perception without a formal risk assessment process, fails to meet regulatory requirements and ethical standards. This is because it bypasses the systematic evaluation of scientific data necessary to identify and quantify risks, potentially leading to misallocation of resources or ineffective interventions. It also disregards the legal framework that mandates evidence-based decision-making for environmental health policies, an approach that focuses exclusively on the economic impact of potential regulations, without adequately considering the public health risks identified through a risk assessment, is also professionally unacceptable. While economic considerations are important, they cannot supersede the primary mandate of public health to protect the population from environmental hazards. This approach violates the ethical principle of prioritizing health and safety, and may fail to comply with regulations that require risk reduction as a primary objective. An approach that adopts a precautionary principle without a clear understanding of the specific risks and the regulatory framework for its application can lead to overregulation or underregulation. While the precautionary principle is a valuable tool, its application must be informed by a thorough risk assessment and be consistent with the jurisdiction's specific legal and policy guidelines for its use. Without this, it can result in arbitrary or disproportionate policy decisions that do not effectively serve public health goals. Professional reasoning. Professionals should approach environmental health policy decisions by first understanding the specific regulatory framework governing the jurisdiction. This involves identifying the relevant laws, guidelines, and standards that dictate the process for risk assessment and policy development. The next step is to conduct a comprehensive risk assessment, systematically evaluating potential hazards, exposure pathways, and the dose-response relationship to characterize the level of risk. This scientific foundation then informs the development of policy options, which should be evaluated not only for their effectiveness in mitigating identified risks, but also for their feasibility, economic impact, and alignment with ethical principles and public health goals. Continuous monitoring and evaluation of implemented policies are crucial to ensure their ongoing effectiveness and compliance with evolving scientific understanding and regulatory requirements. Question 7. Which approach would be most ethically sound and legally defensible for a local health department facing a rapidly spreading, severe infectious disease outbreak in a specific neighborhood, where a significant portion of the community expresses vaccine hesitancy? Option A. Develop a tiered intervention strategy that begins with enhanced community engagement, transparent communication about risks and benefits, and the provision of accessible voluntary vaccination, while reserving the consideration of mandatory measures only if these initial steps prove insufficient and the public health threat escalates significantly. Option B. Mandate vaccination for all essential workers within the affected neighborhood and strongly encourage residents to get vaccinated without further coercive measures. Option C. Implement a mandatory vaccination policy for all residents in the affected neighborhood, with limited exceptions, to rapidly achieve herd immunity and contain the outbreak. Option D. Focus solely on public education campaigns and voluntary vaccination clinics, respecting individual autonomy above all else, even if containment is significantly delayed. The correct answer is C. Implement a mandatory vaccination policy for all residents in the affected neighborhood, with limited exceptions, to rapidly achieve herd immunity and contain the outbreak. Explanation. This scenario presents a classic public health ethics challenge involving competing values, the collective good versus individual autonomy, and the equitable distribution of limited resources. A local health department has identified a highly contagious and potentially severe infectious disease outbreak in a specific neighborhood. To contain the spread, they are considering mandatory vaccination for all residents in the affected area, even those who are hesitant or refuse vaccination. This raises ethical concerns about coercion, informed consent, and potential stigmatization of the affected community. The correct approach prioritizes a balanced consideration of public health principles, ethical values, and legal frameworks. It involves robust community engagement, transparent communication about risks and benefits, and exploring less restrictive alternatives before resorting to mandatory measures. This approach upholds the ethical principles of beneficence, acting in the best interest of the community, non-maleficence, avoiding harm, justice, fair distribution of burdens and benefits, and respect for autonomy, acknowledging individuals' right to make decisions about their health. Legally, it aligns with the general understanding that public health interventions, while sometimes necessary to override individual rights for the greater good, must be demonstrably necessary, proportionate, and the least restrictive means to achieve a compelling public health objective. An incorrect approach would be to immediately implement mandatory vaccination without adequate community consultation or exploring less coercive measures. This would fail to respect individual autonomy and could erode public trust, potentially leading to greater resistance and undermining long-term public health efforts. Ethically, it could be seen as paternalistic and unjust, particularly if the community has historically experienced mistrust of public health institutions. Legally, such an action might be challenged if it cannot be proven to be the least restrictive means to achieve a compelling public health goal. Another incorrect approach would be to solely focus on individual rights and refuse any form of mandatory intervention, even in the face of a severe outbreak. While respecting autonomy is crucial, public health also has a responsibility to protect the community from communicable diseases. Failing to act decisively when necessary could violate the principle of justice by disproportionately burdening those who are vulnerable to the disease and its consequences. A third incorrect approach might involve prioritizing speed and efficiency over ethical considerations, such as implementing a policy without clear communication or addressing community concerns. This could lead to unintended negative consequences, such as fear, misinformation, and backlash, ultimately hindering the public health response. The professional decision-making process in such situations requires a systematic ethical analysis. This involves 1. Identifying the ethical principles at play. 2. Gathering relevant scientific and epidemiological data. 3. Understanding the legal context. 4. Engaging with stakeholders, especially the affected community. 5. Exploring a range of intervention options, from education and voluntary measures to more restrictive ones. 6. Assessing the potential benefits and harms of each option. And 7. Selecting the option that best balances competing values and is justifiable on ethical and legal grounds. Transparency, accountability, and a commitment to equity should guide every step. Question 8. Risk assessment procedures indicate a novel, highly contagious infectious disease is spreading rapidly within the community, with potential for significant morbidity and mortality. Given the urgency of the situation and the need for immediate action to inform public health interventions, which epidemiological data source would be the most appropriate primary tool for initial risk assessment? Option A. Review of established registries for chronic respiratory illnesses. Option B. Collection of data from a newly initiated disease-specific registry. Option C. Analysis of recent mortality data from death certificates. Option D. Implementation of a comprehensive community-wide seroprevalence survey. Correct answer is C. Analysis of recent mortality data from death certificates. Explanation. Scenario analysis. This scenario presents a common challenge in public health practice, the need to assess the impact of a potential health threat using limited and potentially disparate data. The professional challenge lies in selecting the most appropriate epidemiological data source for a timely and accurate risk assessment, considering the specific characteristics of the threat and the strengths and weaknesses of each data source. The urgency of a risk assessment for a novel infectious disease necessitates a rapid yet reliable approach, demanding careful judgment in data selection. Correct approach analysis. Utilizing vital statistics, specifically mortality data, is the most appropriate approach in this scenario. Vital statistics, such as death certificates, provide a foundational, albeit often lagging, record of the ultimate outcome of many diseases. For a novel infectious disease with potentially severe consequences, tracking mortality trends can provide crucial early signals of an escalating public health crisis, even if the exact incidence or prevalence is not yet fully understood. This approach aligns with the public health principle of monitoring population health outcomes and is a fundamental component of surveillance systems. Regulatory frameworks for public health surveillance often mandate the collection and analysis of vital statistics as a core activity. Incorrect approach is analysis. Relying solely on disease registries would be an inappropriate initial approach. Disease registries, while valuable for tracking specific conditions, are typically established for chronic or well-defined diseases and may not exist or be comprehensive enough to capture a novel, rapidly spreading infectious agent in its early stages. The lag time in establishing and populating such a registry would render it ineffective for a timely risk assessment of an emergent threat. Depending solely on ad hoc surveys would also be professionally unacceptable. While surveys can gather specific information, conducting a representative and statistically sound survey for a novel infectious disease requires significant time for design, sampling, data collection, and analysis. This process is too slow to provide the immediate insights needed for an urgent risk assessment of an emerging infectious disease. The potential for sampling bias and recall bias in surveys further diminishes their reliability for rapid assessment of a novel threat. Professional reasoning. Professionals faced with this situation should employ a tiered approach to data utilization. First, leverage existing, readily available, and reliable data sources that capture critical health outcomes, such as vital statistics. Simultaneously, initiate efforts to gather more specific data, such as through enhanced surveillance for symptomatic cases or, if feasible, rapid sentinel surveillance. The decision-making process should prioritize data that can provide the most immediate and impactful information for risk assessment, while acknowledging the limitations of each source and planning for more detailed data collection as the situation evolves. Ethical considerations demand acting on the best available evidence to protect public health, even if that evidence is imperfect. Question 9. Market research demonstrates a new dietary supplement containing a novel botanical extract is being developed for widespread consumer use. The manufacturer has provided preliminary toxicological data indicating no acute toxicity at high doses in animal models and an estimated daily exposure level for consumers. As a certified and public health professional tasked with advising on public health implications, which of the following actions best reflects a regulatory compliance and public health protection approach? Option A. Recommend approval of the supplement based on the absence of acute toxicity and the manufacturer's estimated low exposure levels, assuming these are sufficient to prevent harm. Option B. Advise against the supplement's market entry solely because the botanical extract is novel and its long-term effects are not fully understood, without a detailed scientific evaluation of the provided data. Option C. Focus exclusively on the estimated consumer exposure levels, assuming that if they are below a generic threshold for chemical exposure, the supplement is safe, irrespective of the specific toxicological profile of the botanical extract. Option D. Conduct a comprehensive review of the provided toxicological studies to establish dose-response relationships, identify critical endpoints, and critically evaluate the exposure assessment to determine if estimated human exposure levels are adequately protective, considering potential chronic effects and vulnerable populations. The correct answer is A. Recommend approval of the supplement based on the absence of acute toxicity and the manufacturer's estimated low exposure levels, assuming these are sufficient to prevent harm. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified and public health professional by requiring them to interpret and apply toxicological principles, specifically dose-response relationships and exposure assessment, within the context of a new consumer product. The challenge lies in balancing the need to protect public health with the economic realities of product development and market introduction. A critical judgment is required to determine the adequacy of the provided toxicological data and exposure assessment to ensure the product's safety for its intended use and foreseeable misuse, adhering strictly to U.S. regulatory frameworks. Correct approach analysis. The correct approach involves a thorough review of the submitted toxicological data to understand the dose-response relationships for potential adverse effects. This includes evaluating the quality and relevance of the studies, identifying critical endpoints, and determining the no observed adverse effect level (NOAL) or lowest observed adverse effect level (LOAL). Concurrently, the exposure assessment must be critically examined to determine the likely human exposure levels under various use scenarios, considering both intended and foreseeable misuse. The professional must then compare these estimated exposure levels to the established toxicological reference values, e.g., acceptable daily intake ADI, reference dose RFD, derived from the dose-response data. If the estimated exposure is significantly below the reference values, with appropriate safety factors applied, the product can be considered safe. This approach aligns with the U.S. regulatory framework, such as that overseen by the Environmental Protection Agency, EPA, and the Food and Drug Administration, FDA, which mandate rigorous scientific evaluation of chemical risks to human health. The ethical imperative is to prioritize public safety by ensuring that the product's potential risks are adequately characterized and managed. Incorrect approaches analysis. One incorrect approach would be to accept the manufacturer's assurance of safety based solely on the absence of reported acute toxicity in preliminary animal studies, without a comprehensive dose-response evaluation or a robust exposure assessment. This fails to account for chronic or subchronic effects, developmental toxicity, or carcinogenicity, which may only manifest at lower doses over extended periods. Ethically, this prioritizes commercial interests over public health. Regulatory failure occurs because it bypasses the requirement for a thorough risk assessment mandated by agencies like the EPA under the Toxic Substances Control Act (TSCA), or the FDA for food additives and consumer products. Another incorrect approach would be to focus solely on the estimated exposure levels without critically evaluating the underlying toxicological data. If the exposure assessment is flawed or based on unrealistic assumptions, even low estimated exposures might not adequately protect vulnerable populations. This approach neglects the fundamental principle of toxicology that risk is a function of both hazard, toxicity, and exposure. Regulatory failure stems from an incomplete risk characterization, which is a cornerstone of U.S. public health regulations. A third incorrect approach would be to dismiss the product as unsafe based on a single, high-dose study that shows an adverse effect, without considering the dose-response relationship or the relevance of that effect to human exposure levels. This overlooks the principle that the dose makes the poison, and that effects observed at extremely high, non-environmentally relevant doses may not indicate a risk at typical exposure levels. This approach fails to conduct a scientifically sound risk assessment, potentially leading to unnecessary restrictions or bans, and is not in line with the nuanced risk evaluation required by U.S. regulatory bodies. Professional reasoning. Professionals should adopt a systematic risk assessment framework. This involves hazard identification. What adverse effects can the substance cause? Dose-response assessment. How much of the substance causes what effect? Exposure assessment. How much of the substance are people exposed to? And risk characterization. What is the probability of adverse effects in the exposed population? When evaluating a new product, the professional must critically scrutinize the manufacturer's data, identify any data gaps, and ensure that the dose-response relationships and exposure assessments are scientifically sound and protective of public health, adhering to established U.S. regulatory guidelines and ethical principles of public health protection. Question 10. The investigation demonstrates a cluster of individuals diagnosed with type 2 diabetes within a specific geographic area over the past year. Public health officials are assessing the overall burden of this condition in the community, which epidemiological concept best describes the proportion of the population that has type 2 diabetes at this particular point in time. Option A, mortality. Option B, incidence. Option C, prevalence. Option D, morbidity. The correct answer is C, prevalence. Explanation. The investigation demonstrates a common challenge in public health surveillance, interpreting data to understand the burden of disease and inform targeted interventions. The professional challenge lies in accurately distinguishing between different measures of disease occurrence to correctly assess the scope of a health problem and its impact on a population. This requires a nuanced understanding of epidemiological concepts beyond simple counts. The correct approach represents best professional practice because it accurately applies the definition of prevalence to describe the existing burden of a chronic condition within the specified population at a given time. This aligns with the ethical and professional responsibility of public health professionals to use precise epidemiological language to communicate findings and guide resource allocation. Regulatory frameworks for public health practice emphasize the importance of accurate data interpretation and reporting to ensure evidence-based decision-making. An incorrect approach that focuses solely on the number of new cases fails to capture the full picture of the disease's impact. This is a regulatory and ethical failure because it misrepresents the disease burden, potentially leading to underestimation of the need for services and interventions for those already living with the condition. Another incorrect approach that conflates incidence with prevalence is a failure in basic epidemiological understanding, which is a core competency expected of certified public health professionals. This can lead to flawed conclusions about disease dynamics and the effectiveness of control measures. A third incorrect approach that focuses on mortality without considering the morbidity aspect provides an incomplete picture of the disease's impact, failing to account for the significant burden of illness and disability experienced by affected individuals. This is a failure to comprehensively assess public health needs. Professionals should use a decision-making framework that begins with clearly defining the epidemiological measure being sought, e.g., existing cases, new cases, deaths. This involves understanding the definitions of incidence, prevalence, morbidity, and mortality, and how they relate to the specific health issue under investigation. The next step is to critically evaluate the available data to determine which measure it represents. Finally, professionals must select the epidemiological term that most accurately and comprehensively describes the data and its implications for public health action, ensuring clear and precise communication. Question 11. The monitoring system demonstrates a statistically significant increase in reported cases of a specific gastrointestinal illness in a particular geographic region over the past week, exceeding the expected seasonal baseline. What is the most appropriate immediate next step for public health officials? Option A. Systematically review and verify the reported cases against a predefined case definition. Compare with historical data for the same period and initiate preliminary descriptive epidemiology to characterize the potential outbreak. Option B. Initiate a broad public awareness campaign through media channels, urging residents to avoid specific foods or activities until the cause is identified. Option C. Immediately convene a public health advisory committee to draft urgent public health advisories and recommend broad preventative measures for the general population. Option D. Dispatch teams to interview healthcare providers to gather anecdotal information about potential common exposures and begin searching for a single, obvious common source of infection. The correct answer is C. Immediately convene a public health advisory committee to draft urgent public health advisories and recommend broad preventative measures for the general population. Explanation. Scenario analysis. This scenario presents a common challenge in public health, a potential outbreak detected through routine surveillance. The professional challenge lies in the urgency to confirm the outbreak, identify its source, and implement control measures rapidly, while simultaneously ensuring the accuracy and validity of the investigation. Missteps can lead to delayed interventions, unnecessary panic, or misallocation of resources. The need for a systematic, evidence-based approach is paramount. Correct approach analysis. The correct approach emphasizes immediate verification of the reported increase in cases against established baseline data and diagnostic criteria. This aligns with fundamental principles of epidemiological investigation, which prioritize confirming the existence and magnitude of a potential outbreak before proceeding to more resource-intensive steps. Regulatory frameworks for public health surveillance, such as those guiding the Centers for Disease Control and Prevention, CDC, in the U.S., mandate this initial validation to ensure that public health actions are based on confirmed events and not spurious data fluctuations. Ethically, this prevents unnecessary alarm and ensures that interventions are targeted and effective. Incorrect approaches analysis. Initiating widespread public advisement and implementing broad control measures without first confirming the outbreak is a significant regulatory and ethical failure. Public health advisories carry weight and can impact public behavior and economic activity. Issuing them prematurely based on unverified data violates the principle of proportionality and can erode public trust. This approach bypasses the critical step of case definition and verification, which is a cornerstone of outbreak investigation protocols. focusing solely on identifying a single common source without considering other potential transmission patterns, e.g., person to person, is also problematic. Outbreak investigations must be flexible and adapt to emerging evidence. Limiting the scope prematurely can lead to missing the true source or mode of transmission, hindering effective control. This fails to adhere to comprehensive epidemiological methodologies that consider multiple hypotheses. Relying exclusively on anecdotal reports from healthcare providers without systematic data collection and analysis is another failure. While anecdotal information can be a valuable signal, it is not a substitute for rigorous data gathering, laboratory confirmation, and epidemiological analysis. Public health regulations require evidence-based decision-making, and anecdotal reports alone do not meet this standard for initiating a full-scale outbreak response. Professional reasoning. Professionals should approach potential outbreak signals with a structured, phased methodology. The initial phase involves signal detection and verification. This includes reviewing surveillance data, comparing it to historical trends, and establishing a clear case definition. Once an outbreak is confirmed, the investigation proceeds to descriptive epidemiology, who, what, where, when, hypothesis generation, analytical studies to test hypotheses, and finally, control measures and communication. Throughout this process, continuous evaluation and adaptation based on new data are crucial. Ethical considerations, such as transparency, proportionality, and minimizing harm, must guide every step. Question 12. Performance analysis shows that a recently implemented community-wide vaccination campaign has seen a significant increase in the number of individuals receiving the vaccine. To best evaluate the policy's overall effectiveness, which approach should public health managers prioritize? Option A. Conducting a retrospective comparison of current vaccination rates with those from 5 years prior, without adjusting for demographic shifts or other public health interventions. Option B. Relying primarily on social media sentiment analysis to gauge public perception of the vaccination campaign's success. Option C. Analyzing trends in vaccine-preventable disease incidence and mortality rates within the target population, alongside qualitative feedback from healthcare providers and community members regarding access and perceived benefits. Option D. Focusing solely on the total number of vaccine doses administered and comparing this figure to the campaign's initial outreach targets. The correct answer is C. Analyzing trends in vaccine-preventable disease incidence and mortality rates within the target population, alongside qualitative feedback from healthcare providers and community members regarding access and perceived benefits. Explanation. Scenario analysis. This scenario presents a common challenge in public health management, evaluating the effectiveness of a newly implemented health policy. The professional challenge lies in moving beyond superficial metrics to a comprehensive assessment that considers both intended outcomes and unintended consequences, while adhering to the principles of evidence-based practice and ethical considerations in public health. The need for careful judgment arises from the potential for misinterpreting data, leading to flawed policy adjustments or premature abandonment of a potentially beneficial initiative. Correct approach analysis. The correct approach involves a multifaceted evaluation that triangulates data from various sources. This includes assessing objective health outcome indicators, e.g., disease incidence, mortality rates, patient and provider satisfaction surveys, and qualitative data from focus groups or interviews. This comprehensive method aligns with best practices in program evaluation, emphasizing the importance of understanding the policy's impact from multiple perspectives and across different domains of health. It also adheres to ethical principles of accountability and transparency by seeking to understand the full impact of public health interventions. Incorrect approaches analysis. One incorrect approach focuses solely on easily quantifiable metrics like the number of participants or the amount of funding disbursed. This fails to assess the actual impact on health outcomes or community well-being, neglecting the core purpose of public health policy. It represents a failure to conduct a thorough and meaningful evaluation, potentially leading to the continuation of ineffective programs or the discontinuation of beneficial ones based on incomplete evidence. Another incorrect approach relies exclusively on anecdotal evidence or testimonials from a small, self-selected group. Valuable for understanding lived experiences, this method lacks scientific rigor and generalizability. It can lead to biased conclusions and does not provide the objective data necessary for informed policy decisions, violating the principle of evidence-based practice. A third incorrect approach involves comparing the new policy's outcomes directly to those of a previous, potentially outdated or less effective policy, without accounting for confounding factors or changes in the broader social and environmental context. This can lead to inaccurate attributions of success or failure, and fails to isolate the true impact of the current policy, demonstrating a lack of methodological soundness in the evaluation. Professional reasoning. Professionals should approach policy evaluation by first clearly defining the policy's objectives and intended outcomes. Then, they should develop a robust evaluation plan that includes a mix of quantitative and qualitative data collection methods, ensuring that the chosen metrics are valid and reliable indicators of success. This plan should also consider potential confounding variables and the broader context in which the policy is implemented. Finally, findings should be interpreted cautiously, acknowledging limitations, and used to inform iterative improvements to the policy or future policy development, always prioritizing the health and well-being of the population. Question 13. Governance review demonstrates that a proposed large-scale residential development on the outskirts of a growing city has undergone an initial environmental impact assessment (IA), commissioned by the developer. While the EIA addresses general environmental concerns like habitat disruption and water runoff, it provides only superficial analysis of potential public health impacts, particularly regarding increased air pollution from traffic, potential for vector-borne disease transmission due to altered drainage patterns, and the long-term effects of proximity to an existing industrial zone. As a public health professional tasked with advising the local planning authority, what is the most appropriate course of action to ensure the health and safety of future residents and the surrounding community? Option A. Recommend that the planning authority prioritize the economic benefits of the development and defer any detailed public health investigations until after residents have moved in, at which point any emergent health issues can be addressed reactively. Option B. Advocate for a comprehensive, independent environmental health impact assessment (IA) that specifically investigates potential risks to air quality, vector-borne diseases, and cumulative health effects from industrial proximity, ensuring it adheres to established public health guidelines and regulatory requirements for such assessments. Option C. Inform the planning authority that environmental health impact assessments are primarily the responsibility of environmental agencies and suggest deferring the detailed public health review to them without actively participating in the process. Option D. Accept the developer's EIA as sufficient, assuming that any significant health risks would have been identified and addressed by the developer's consultants, and focus on other aspects of community planning. The correct answer is B. Advocate for a comprehensive, independent environmental health impact assessment (IA) that specifically investigates potential risks to air quality, vector-borne diseases, and cumulative health effects from industrial proximity, ensuring it adheres to established public health guidelines and regulatory requirements for such assessments. Explanation. Scenario analysis. This scenario presents a common challenge in public health where a proposed development has potential environmental health impacts that are not fully understood or adequately addressed by the initial assessment. The public health professional must navigate conflicting interests, limited data, and the imperative to protect community well-being while respecting development processes. The challenge lies in ensuring that the assessment is robust, scientifically sound, and considers the full spectrum of potential health risks, not just those immediately apparent or easily quantifiable. Correct approach analysis. The correct approach involves advocating for a comprehensive, independent environmental health impact assessment (IA) that specifically addresses the identified concerns. This aligns with the principles of precautionary action and the ethical obligation of public health professionals to protect vulnerable populations. Such an assessment would adhere to established public health methodologies and regulatory guidelines for EIA, ensuring that potential risks to air quality, water contamination, noise pollution, and vector-borne diseases are thoroughly investigated. This proactive stance is crucial for informing evidence-based decision-making and preventing adverse health outcomes, upholding the public health mandate to promote and protect community health. Incorrect approach is analysis. One incorrect approach is to accept the developer's initial assessment without further scrutiny, especially if it appears to downplay potential risks or lacks specific detail on environmental health factors. This fails to uphold the public health duty to critically evaluate information and advocate for community safety, potentially leading to regulatory and ethical breaches by overlooking significant health hazards. Another incorrect approach is to focus solely on the economic benefits of the development and dismiss environmental health concerns as minor or speculative. This prioritizes economic considerations over public health, violating the core ethical principles of public health practice and potentially contravening regulations that mandate the consideration of health impacts in development approvals. A third incorrect approach is to delay action or defer responsibility to other agencies without actively engaging in the assessment process. This demonstrates a lack of professional initiative and can result in a missed opportunity to influence the development's design and mitigation strategies, thereby failing to fulfill the public health role in safeguarding community health. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough review of the available information, identifying gaps and potential risks. They should then engage with stakeholders, including the developer, regulatory bodies, and community members, to understand concerns and gather further data. When significant environmental health risks are identified or suspected, the professional's duty is to advocate for rigorous, independent assessments that adhere to established scientific and regulatory standards. This involves clearly communicating potential risks and recommending appropriate mitigation measures, ensuring that public health is a central consideration in all decision-making processes. Question 14. Market research demonstrates that a local health department is investigating a potential link between a specific dietary supplement and a rare gastrointestinal illness. They have conducted a case control study, identifying individuals with the illness cases and similar individuals without the illness controls, and then retrospectively assess their use of the dietary supplement. Which measure of association is most appropriate for this study designed to quantify the strength of the relationship between supplement use and the illness? Option A, odds ratio. Option B, attributable risk. Option C, risk ratio. Option D, prevalence ratio. The correct answer is A, odds ratio. Explanation. Scenario analysis. This scenario presents a common challenge in public health where data on disease occurrence and exposure is collected, and the goal is to understand the strength of the association between an exposure and an outcome. The professional challenge lies in selecting the most appropriate measure of association to communicate findings effectively and inform public health intervention, while adhering to the principles of epidemiological study design and interpretation. Misinterpreting or misapplying these measures can lead to flawed conclusions about causality and ineffective resource allocation. Correct approach analysis. The correct approach involves selecting a measure of association that accurately reflects the relationship between the exposure and the outcome, considering the study design. For a case control study, the odds ratio is the appropriate measure of association because it estimates the odds of exposure among cases compared to the odds of exposure among controls. This is because incidence risk cannot be directly calculated in a case control study. The odds ratio approximates the risk ratio when the disease is rare. This aligns with the principles of epidemiological measurement and the limitations of different study designs, ensuring that the interpretation of the association is valid within the context of the data collected. Incorrect approaches analysis. One incorrect approach would be to use the risk ratio in a case control study. The risk ratio is calculated as the incidence of the outcome in the exposed group divided by the incidence of the outcome in the unexposed group. In a case control study, the selection of participants is based on their disease status, case or control, not on their exposure status. Therefore, the incidence of the disease cannot be directly determined, making the calculation of a risk ratio inappropriate and leading to a misrepresentation of the association. Another incorrect approach would be to use the attributable risk in a case control study without proper adjustment or consideration of the study design. Attributable risk quantifies the excess risk of a health outcome in an exposed population that can be attributed to the exposure. While valuable for intervention planning, its direct calculation and interpretation are most straightforward in cohort studies where incidence can be measured. Applying it directly from case control data, without acknowledging the odds ratio as the primary measure of association, can lead to overestimation or misinterpretation of the public health impact. Professional reasoning. Professionals must first identify the study design, e.g., cohort, case control, cross-sectional, as this dictates the appropriate measures of association. For case control studies, the odds ratio is the primary measure. For cohort studies, both risk ratio and attributable risk are relevant. Understanding the assumptions and limitations of each measure is crucial. When communicating findings, it is important to select the measure that best represents the data and is most interpretable for the intended audience, while clearly stating the measure used and its derivation. Question 15. Operational review demonstrates that a biostatistics team has completed an analysis of a public health intervention's effectiveness. The analysis yielded statistically significant positive results supporting the intervention's efficacy, but also revealed statistically significant negative findings regarding a secondary outcome that were not initially hypothesized. The team lead is considering how to present these findings to stakeholders, acknowledging pressure to secure continued funding based on demonstrating success. What is the most ethically sound and professionally responsible approach for the biostatistics team to present these findings? Option A. Delay the dissemination of the negative findings, emphasizing the positive results in the initial report and planning to address the negative outcomes in a subsequent, less prominent communication. Option B. Transparently report all statistically significant findings, both positive and negative, along with appropriate context and interpretation. Option C. Conduct further exploratory analyses with different statistical models until a more uniformly positive narrative emerges before presenting any findings. Option D. Focus the presentation solely on the statistically significant positive findings that support the intervention's efficacy, as these are most relevant to securing future funding. The correct answer is B. Transparently report all statistically significant findings, both positive and negative, along with appropriate context and interpretation. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between the desire to present positive research findings and the ethical obligation to accurately report all data, including potentially unfavorable results. Public health professionals are entrusted with providing evidence-based information to guide policy and practice. Misrepresenting or selectively reporting biostatistical data, even with the intention of securing future funding, undermines this trust and can lead to flawed decision-making with potentially harmful consequences for public health. The pressure to demonstrate success can be significant, making it crucial to adhere to rigorous ethical and scientific standards. Correct approach analysis. The correct approach, which involves transparently reporting all statistically significant findings, including those that do not support the initial hypothesis, aligns with the core principles of scientific integrity and ethical research conduct. This approach upholds the commitment to truthfulness and accuracy in data reporting, which is paramount in public health. By presenting a complete picture, stakeholders can make informed decisions based on the totality of the evidence, rather than a biased subset. This also adheres to the principles of good scientific practice, which require full disclosure of methods and results, regardless of their perceived impact. Incorrect approaches analysis. One incorrect approach involves selectively reporting only the statistically significant findings that support the hypothesis, while omitting those that do not. This constitutes scientific misconduct and an ethical breach. It misleads stakeholders by presenting an incomplete and potentially distorted view of the research outcomes. This practice violates the principle of honesty in reporting and can lead to the adoption of ineffective or even harmful public health interventions based on flawed evidence. Another incorrect approach is to reanalyze the data using different statistical methods until a desired outcome is achieved, without a clear scientific justification for the methodological changes. This practice, often referred to as p-hacking or data dredging, is a form of data manipulation that artificially inflates the likelihood of finding statistically significant results. It undermines the validity of the findings and is a serious ethical violation, as it distorts the true statistical reality of the data. A third incorrect approach is to delay the publication or dissemination of findings that are not favorable, hoping for future studies to provide a more positive narrative. While there are legitimate reasons for careful review and validation of research, intentionally withholding unfavorable results to manage perceptions or secure funding is unethical. It prevents the public health community from benefiting from a complete understanding of the evidence, potentially delaying necessary adjustments to public health strategies. Professional reasoning. Professionals facing such dilemmas should first and foremost adhere to established ethical codes and guidelines for research and data reporting. This includes principles of honesty, integrity, and transparency. When faced with conflicting pressures, a decision-making framework should involve consulting with senior colleagues, ethics committees, or institutional review boards. The focus should always be on the scientific validity and ethical implications of the reporting strategy. Prioritizing the accurate and complete representation of data, even if it presents challenges, is essential for maintaining professional credibility and ensuring the best interests of public health. Question 16. Implementation of a comprehensive hazard control strategy for a newly identified chemical irritant in a manufacturing facility, considering both immediate operational continuity and long-term worker well-being, requires a structured approach. Which of the following represents the most compliant and ethically sound course of action for a certified in public health professional overseeing this initiative? Option A. Prioritize the immediate implementation of engineering controls to isolate the hazard at its source, supplemented by robust administrative controls and appropriate personal protective equipment, while concurrently developing a plan for potential process modifications to eliminate or substitute the irritant. Option B. Focus on educating employees about the chemical's risks and encouraging them to report any symptoms, while initiating a review of the process to determine if any changes are feasible in the future without immediate intervention. Option C. Conduct a thorough risk assessment to identify the severity and likelihood of exposure, and then implement control measures strictly following the hierarchy of controls, starting with elimination or substitution, then engineering controls, followed by administrative controls, and finally personal protective equipment as a last resort. Option D. Immediately mandate the use of personal protective equipment for all potentially exposed employees, and conduct extensive training on its proper use and the chemical's hazards, deferring any further control measures until production schedules allow. The correct answer is A. Prioritize the immediate implementation of engineering controls to isolate the hazard at its source, supplemented by robust administrative controls and appropriate personal protective equipment, while concurrently developing a plan for potential process modifications to eliminate or substitute the irritant. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a public health professional to balance the immediate operational needs of a business with the long-term health and safety of its employees, all while navigating a complex regulatory landscape. The pressure to maintain productivity and avoid costly shutdowns can create a conflict of interest, demanding careful judgment to prioritize worker well-being in accordance with established standards. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the identified hazard through a systematic, evidence-based process mandated by occupational health and safety regulations. This involves a thorough risk assessment to understand the nature and extent of the exposure, followed by the implementation of a hierarchy of controls, prioritizing elimination or substitution of the hazardous substance, followed by engineering controls, administrative controls, and finally personal protective equipment, PPE, aligns with the principles of the Occupational Safety and Health Act (OSHA) in the United States, which emphasizes proactive hazard mitigation to prevent occupational illnesses and injuries. This approach is ethically sound as it upholds the professional responsibility to protect worker health. Incorrect approach is analysis. An approach that relies solely on providing personal protective equipment, PPE, without first exploring elimination, substitution, or engineering controls is a regulatory and ethical failure. OSHA regulations mandate that PPE is the last resort in the hierarchy of controls, used only when other methods are not feasible or sufficient. This approach fails to address the root cause of the hazard, potentially exposing workers to risks that could have been eliminated or significantly reduced. It also places an undue burden on the employee to consistently and correctly use PPE, which is prone to human error and may not offer complete protection. An approach that delays or postpones the implementation of control measures due to potential operational disruptions is a significant regulatory and ethical failure. Occupational health and safety laws require employers to provide a safe working environment promptly. Postponing necessary interventions, even with the intention of addressing them later, exposes employees to unacceptable risks and violates the employer's legal and ethical duty of care. This approach prioritizes economic concerns over human health, which is contrary to the fundamental principles of public health and occupational safety. An approach that focuses on employee training regarding the hazards without implementing any physical or administrative controls is insufficient and constitutes a regulatory and ethical failure. While training is a crucial component of an effective safety program, it is not a substitute for hazard control. Relying solely on training assumes employees can consistently avoid exposure through knowledge alone, which is unrealistic and fails to mitigate the inherent risks of the hazard. This approach neglects the employer's responsibility to engineer out or administratively manage hazards to the greatest extent possible. Professional reasoning. Professionals in this situation should employ a systematic risk management framework. This begins with hazard identification and assessment, followed by the evaluation of control options based on the hierarchy of controls: elimination, substitution, engineering, administrative, PPE. Decision-making should be guided by regulatory requirements, e.g., OSHA standards, ethical obligations to protect worker health, and the principle of proportionality, ensuring that control measures are effective and feasible. Documentation of all assessments, decisions, and implemented controls is critical for accountability and continuous improvement. Question 17. The evaluation methodology shows that a county health department is facing significant budget constraints and must reevaluate its health care financing strategies to ensure the sustainability of essential public health services while maximizing population health outcomes. Which of the following approaches represents the most prudent and ethically sound strategy for addressing these financial challenges within the U.S. regulatory framework? Option A. Significantly reducing the scope of preventive services and focusing resources exclusively on emergency response to contain immediate costs, assuming that individuals will seek private care for non-urgent needs. Option B. Implementing a diversified funding model that includes a mix of federal and state grants, local tax allocations, and strategic partnerships with private entities, while prioritizing evidence-based preventive programs with demonstrable cost-effectiveness and a focus on health equity. Option C. Introducing substantial user fees for all public health services, with minimal or no sliding scale or exemptions, to maximize revenue generation and shift the financial burden to service recipients. Option D. Relying primarily on short-term, project-specific grant funding with no long-term financial planning or diversification, to maintain flexibility in program offerings. The correct answer is B. Implementing a diversified funding model that includes a mix of federal and state grants, local tax allocations, and strategic partnerships with private entities, while prioritizing evidence-based preventive programs with demonstrable cost-effectiveness and a focus on health equity. Explanation. Scenario analysis. This scenario presents a common challenge in public health financing, balancing the need for comprehensive health services with the reality of limited budgets and the imperative to ensure equitable access. The public health professional must assess the economic implications of different financing models while adhering to the ethical principles of public health and relevant U.S. regulatory frameworks. The challenge lies in identifying a financing strategy that is both economically sustainable and aligns with public health goals of disease prevention, health promotion, and access to care for all populations, particularly vulnerable ones. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that leverages diverse funding streams and prioritizes evidence-based interventions with demonstrable return on investment for public health. This aligns with U.S. regulatory frameworks such as the Public Health Service Act, which supports a range of preventive and health promotion activities, and the Affordable Care Act, which promotes value-based care and population health initiatives. Best professional practice dictates a proactive, data-driven approach that considers the long-term economic and social benefits of public health investments, rather than solely focusing on immediate cost containment. This approach ensures that resources are allocated efficiently to achieve the greatest public health impact, promoting health equity and reducing disparities. Incorrect approach is analysis. One incorrect approach focuses solely on cost reduction through service cuts. This fails to acknowledge the potential for increased downstream costs associated with untreated or poorly managed health conditions, which constrain emergency services and lead to higher long-term healthcare expenditures. Ethically, it violates the principle of beneficence by potentially compromising the health and well-being of the population. Regulatory failure would occur if these cuts disproportionately affect vulnerable populations, violating anti-discrimination provisions and equity mandates within U.S. public health law. Another incorrect approach prioritizes revenue generation through user fees without considering the impact on access for low-income individuals. This can create financial barriers to essential public health services, exacerbating health disparities. It contravenes the spirit of public health as a collective good and may conflict with federal and state mandates for accessible preventive services. Ethically, it raises concerns about distributive justice. A third incorrect approach relies heavily on a single, unstable funding source, such as discretionary grants with uncertain renewal. This creates financial precariousness, hindering long-term planning and the sustainability of essential public health programs. It demonstrates a lack of fiscal prudence and risk management, which are critical for effective public health operations and can jeopardize the achievement of public health objectives. Professional reasoning. Public health professionals must employ a systematic risk assessment process when evaluating healthcare financing. This involves identifying potential financial risks, e.g., budget shortfalls, inefficient resource allocation, health risks, e.g., increased disease burden due to underfunding, and equity risks, e.g., unequal access to services. The decision-making process should involve stakeholder engagement, data analysis of program effectiveness and cost-effectiveness, and consideration of the broader social determinants of health. Professionals should advocate for diversified and sustainable funding models that align with public health goals and regulatory requirements, ensuring that interventions are evidence-based and contribute to improved population health outcomes and health equity. Question 18. Investigation of a sudden increase in a specific gastrointestinal illness among residents of a community, with initial reports suggesting a potential link to a newly introduced food additive in a popular local restaurant, requires a study design that can efficiently identify past exposures and compare them between ill and healthy individuals. Which study design would be most appropriate for this initial investigation? Option A. Cross-sectional study assessing current dietary habits and illness status simultaneously. Option B. A randomized controlled trial exposing participants to the new food additive. Option C. A case control study comparing the past dietary habits of ill individuals with those of healthy individuals. Option D. A prospective cohort study following individuals who consumed the additive and those who did not. Correct answer is C. A case control study comparing the past dietary habits of ill individuals with those of healthy individuals. Explanation. Scenario analysis. This scenario presents a common challenge in public health research, selecting the most appropriate study design to investigate a potential public health issue with limited initial information and resource constraints. The urgency of the situation, implied by the outbreak, and the need for rapid understanding, adds pressure to the decision-making process. Public health professionals must balance the need for timely data with the scientific rigor required to draw valid conclusions and inform effective interventions. The choice of study design directly impacts the feasibility, cost, ethical considerations, and the strength of evidence that can be generated. Correct approach analysis. A case control study is the most appropriate approach in this scenario because it is efficient for investigating rare diseases or outcomes, and it can be conducted relatively quickly. Given the suspected link to a specific exposure, the new food additive, and the need to understand past exposures, a case control design allows researchers to identify individuals with the outcome illness and compare their past exposure history to that of a control group without the illness. This design is particularly useful when the exposure period precedes the outcome, as is likely with a food additive. It allows for the examination of multiple potential exposures simultaneously. From a regulatory and ethical standpoint, this design minimizes participant burden compared to prospective cohort studies, which would require following a large group over time. It also allows for a more rapid identification of risk factors, which is crucial for public health action. Incorrect approaches analysis. A cross-sectional study would be inappropriate because it measures exposure and outcome at a single point in time. This design cannot establish temporality, meaning it cannot determine whether the exposure preceded the illness, which is essential for inferring causality. It would be difficult to definitively link the food additive to the illness if both are assessed simultaneously. A randomized controlled trial, RCT, is not feasible or ethical in this context. RCTs are designed to test the efficacy of an intervention by randomly assigning participants to receive the intervention or a control. It would be unethical to intentionally expose individuals to a potentially harmful food additive to test its effects. RCTs are also typically resource-intensive and time-consuming, making them unsuitable for investigating an ongoing outbreak. A cohort study, while providing stronger evidence of causality than a cross-sectional study, would also be less efficient and timely for this specific situation. A prospective cohort study would require identifying a group of exposed and unexposed individuals and following them over time to observe who develops the illness. This is time-consuming and may not be practical if the illness is rare or the exposure is recent. A retrospective cohort study could be considered, but a case-control study is generally more efficient for rare outcomes, and when the primary goal is to identify risk factors. Professional reasoning. When faced with an emerging public health issue requiring investigation, professionals should first consider the nature of the suspected relationship, exposure outcome, the prevalence of the outcome, and the urgency of the situation. They should then evaluate study designs based on their ability to establish temporality, efficiency, feasibility, and ethical considerations. A systematic approach involves 1. Clearly defining the research question and hypotheses. 2. Assessing available resources and timelines. 3. Considering the strengths and limitations of each study design in relation to the research question. And 4. Prioritizing designs that can provide timely, valid, and ethically sound evidence to inform public health action. In outbreak investigations, rapid assessment of potential causes is paramount, making designs like case control studies highly valuable. Question 19. Quality control measures reveal a discrepancy between the initial statistical analysis of a public health intervention's effectiveness and a subsequent reevaluation. The initial analysis showed a statistically significant positive outcome, but the reevaluation suggests the significance may be marginal or absent due to potential data anomalies. What is the most ethically sound and professionally responsible course of action for the public health analyst? Option A. Immediately omit the data points identified as potentially anomalous from the dataset to restore the original statistically significant findings. Option B. Proceed with reporting the initial statistically significant findings as planned, without mentioning the quality control alert or the subsequent reevaluation. Option C. Conduct a thorough investigation into the data anomalies and the analytical process to understand the source of the discrepancy, documenting all findings and decisions without altering the original data or analysis until the issue is fully understood. Option D. Rerun the analysis using slightly different statistical models or assumptions until a statistically significant result is achieved, then report this new finding. The correct answer is C. Conduct a thorough investigation into the data anomalies and the analytical process to understand the source of the discrepancy, documenting all findings and decisions without altering the original data or analysis until the issue is fully understood. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a potential conflict between the desire to present statistically significant findings and the ethical obligation to ensure the integrity and transparency of the data analysis. Public health professionals are entrusted with interpreting and disseminating health-related information, and any compromise in the rigor or honesty of their statistical methods can have serious consequences for public trust, policy decisions, and individual health outcomes. The pressure to demonstrate impact or secure funding can create an environment where subtle biases or questionable analytical choices might be considered, making careful ethical judgment paramount. Correct approach analysis. The correct approach, which involves reevaluating the data and analytical methods to understand the discrepancy without altering the original findings, represents best professional practice because it upholds the principles of scientific integrity and transparency. Public health professionals are bound by ethical codes that emphasize honesty, accuracy, and objectivity in their work. This approach prioritizes understanding the root cause of the quality control alert, which could be a data entry error, a flaw in the initial analytical plan, or an unexpected finding that requires further investigation. It aligns with the ethical imperative to report findings truthfully, even if they are not as impactful as initially hoped, and to be accountable for the analytical process. This method ensures that any subsequent reporting or decision-making is based on a sound and verifiable understanding of the data. Incorrect approach is analysis. One incorrect approach involves selectively omitting data points that do not support the desired outcome. This is a direct violation of ethical principles related to data integrity and honesty. It constitutes scientific misconduct by manipulating results to fit a preconceived narrative, rather than reflecting the reality of the data. This action undermines the credibility of the public health professional and the organization they represent, and it can lead to flawed public health interventions or policies based on inaccurate information. Another incorrect approach is to proceed with the original analysis and report the statistically significant findings without acknowledging the quality control alert. This failure to disclose a significant discrepancy in data quality or analytical integrity is a breach of transparency and honesty. It misleads stakeholders and the public about the robustness of the findings. Ethically, public health professionals have a duty to report all relevant information, including potential limitations or issues with the data or analysis, to ensure informed decision-making. A third incorrect approach is to immediately rerun the analysis with slightly modified parameters or assumptions to achieve the desired statistical significance, without a clear, documented, and justifiable rationale for these modifications. This can be seen as p-hacking or data dredging, where the analysis is manipulated post hoc to find a statistically significant result. This practice is ethically unsound, as it prioritizes achieving a desired outcome over genuine scientific inquiry, and can lead to spurious findings that are not reproducible or generalizable. It violates the principle of objectivity and can lead to the dissemination of unreliable information. Professional reasoning. Professionals facing such a situation should first pause and acknowledge the quality control alert as a critical signal requiring immediate attention. The decision-making process should involve a systematic review of the data collection, cleaning, and analytical steps. This includes consulting with colleagues or supervisors, documenting all steps taken to investigate the discrepancy, and adhering to established protocols for data quality assurance. The ultimate goal is to ensure that the reported findings are accurate, reliable, and ethically sound, even if they require further investigation or do not align with initial expectations. Transparency and a commitment to the scientific method are the guiding principles. Question 20. The assessment process reveals that a public health department's strategic plan outlines ambitious goals for reducing chronic disease prevalence, but the program evaluation efforts are primarily focused on tracking the number of workshops conducted and brochures distributed, with little attention paid to changes in health behaviors or disease outcomes. Which of the following approaches best aligns with optimizing the strategic planning and program evaluation process in this context? Option A. Redesign the evaluation framework to include outcome and impact indicators that directly measure changes in health behaviors and chronic disease prevalence, and integrate these findings into the next strategic planning cycle for program adjustments. Option B. Increase the frequency of workshop delivery and expand the distribution of informational materials to ensure broader reach, assuming that increased activity will naturally lead to improved outcomes. Option C. Focus the evaluation solely on the efficiency of resource utilization in delivering workshops and distributing materials, as cost-effectiveness is the primary metric for public health program success. Option D. Conduct a comprehensive review of the strategic plan's long-term vision, deferring any immediate changes to the evaluation process until the strategic goals are more clearly defined. Correct answer is A. Redesign the evaluation framework to include outcome and impact indicators that directly measure changes in health behaviors and chronic disease prevalence, and integrate these findings into the next strategic planning cycle for program adjustments. Explanation. The assessment process reveals a common challenge in public health: the gap between strategic planning and effective program evaluation. This scenario is professionally challenging because it requires a nuanced understanding of how to translate broad public health goals into measurable outcomes and how to use evaluation data to inform future strategic decisions. The effectiveness of public health interventions hinges on robust evaluation, which in turn relies on well-defined strategic plans. Misalignment can lead to wasted resources, ineffective programs, and ultimately, a failure to improve population health. Careful judgment is required to ensure that evaluation methods are appropriate, data is interpreted accurately, and findings are integrated back into the strategic planning cycle. The correct approach represents best professional practice by emphasizing a cyclical and integrated process. Strategic planning should define clear, measurable objectives, and program evaluation should be designed from the outset to assess progress against these objectives. This ensures that evaluation is not an afterthought but a core component of program management and strategic refinement. This aligns with the principles of evidence-based public health practice, which mandates the use of data to guide decision-making and improve program effectiveness. Ethical considerations also demand accountability for public resources and a commitment to achieving desired health outcomes for the population. An incorrect approach that focuses solely on process measures without linking them to outcome objectives fails to demonstrate program impact. This is a regulatory failure because it does not provide the necessary evidence to justify continued funding or to demonstrate accountability to stakeholders and the public. Ethically, it represents a failure to be transparent about program effectiveness. Another incorrect approach that prioritizes retrospective data collection without a clear evaluation framework is also problematic. This can lead to incomplete or irrelevant data, making it difficult to draw meaningful conclusions. This is a professional failure as it suggests a lack of foresight in program design and evaluation planning, potentially leading to misinformed strategic adjustments. Finally, an approach that treats evaluation as a one-time event rather than an ongoing feedback loop neglects the dynamic nature of public health challenges and the need for continuous improvement. This is a strategic and operational failure, hindering the ability to adapt to changing circumstances and optimize resource allocation. Professionals should approach this situation by first ensuring that the strategic plan includes SMART, specific, measurable, achievable, relevant, time-bound objectives. Subsequently, the evaluation plan should be developed concurrently with the program design, outlining the specific indicators, data collection methods, and analysis techniques that will be used to assess progress towards these objectives. The evaluation findings should then be systematically reviewed and used to inform revisions to the strategic plan and program implementation, creating a continuous improvement cycle.